Before vaccination, providers should counsel vaccine recipients about expected local and systemic post-vaccination symptoms. Unless persons develop a contraindication to vaccination, they should be encouraged to complete the series even if they develop local or systemic symptoms following the first dose in order to optimize protection against COVID-19. Antipyretic or analgesic medications, such as acetaminophen or nonsteroidal anti-inflammatory drugs, may be taken for the treatment of post-vaccination local or systemic symptoms if medically appropriate. However, routine prophylactic administration of these medications for the purpose of preventing post-vaccination symptoms is not currently recommended, as information on the impact of such use on Pfizer-BioNTech COVID-19 vaccine-induced antibody responses is not available at this time. Next slide. 2 doses of the Pfizer-BioNTech COVID-19 vaccine are required to achieve high efficacy. Thus, patients should be counseled on the importance of completing the 2-dose series in order to optimize protection. Next slide. However, protection from the vaccine is not immediate. The currently available vaccine is a 2-dose series, and it will take 1 to 2 weeks following the second dose before a person is considered fully vaccinated. Additionally, as no vaccine is 100% effective, some vaccinated people may still get COVID-19 disease. Given the currently limited information on how well the vaccine works in the general population, how much it may reduce disease severity and transmission, and how long protection lasts, vaccinated persons should continue to follow all current guidance, including those listed below, to protect themselves and others. Next slide. Next, I'll review contraindications and precautions to vaccination. Next slide. Severe allergic reaction, such as anaphylaxis to any component of the Pfizer-BioNTech COVID-19 vaccine, is a contraindication to vaccination listed in the package insert. Appropriate medical treatment used to manage immediate allergic reactions must be immediately available in the event that an acute anaphylactic reaction occurs following administration of the vaccine. In addition, because of reports of anaphylactic reactions in persons vaccinated outside of clinical trials, severe allergic reaction to any vaccine or injectable therapy is a precaution to vaccination at this time. Vaccination providers should observe patients after vaccination to monitor for the occurrence of immediate adverse reactions. Persons with a history of anaphylaxis should be observed for 30 minutes and all other persons for 15 minutes. Next slide. I just wanted to briefly mention that we are planning an algorithm to help providers understand the contraindications and precautions a little bit more clearly. I think the one thing I just wanted to point out without going into details of everything, as this will be posted elsewhere, is that when we mentioned that any anaphylactic reaction to any vaccine or other injectable medication, we want to emphasize that we are not including people with allergies to things like food, pet dander, insects, environmental allergens, etc., or people who have an allergy only to oral medications, or people who have a family history of anaphylaxis, etc. Those people can proceed with vaccination as long as they have no other contraindications. So we're really emphasizing those people with anaphylaxis to injectable medications or vaccines. Next slide. Finally, I'll review the interpretation of SARS-CoV-2 test results in vaccinated persons. Next slide. Prior receipt of the Pfizer-BioNTech COVID-19 vaccine will not affect the results of SARS-CoV-2 nucleic acid amplification or antigen tests. Currently available antibody tests for SARS-CoV-2 assess IgM and or IgG to one of 2 viral proteins, spike or nucleocapsid. Because the Pfizer-BioNTech COVID-19 vaccine contains mRNA that encodes the spike protein, a positive test for spike protein IgM or IgG could indicate either prior infection or vaccination. To evaluate for evidence of prior infection in an individual with a history of Pfizer-BioNTech COVID-19 vaccination, a test specifically evaluating IgM or IgG to the nucleocapsid protein should be used. Next slide. Finally, I'll just mention a few clinical resources for additional information. Next